The implementation of healthcare innovation is usually complex. It is often the case that healthcare professionals are working together to achieve different goals for their patient. Healthcare professionals are also aware that successful implementation depends on the contribution of each individual. When implementing a new healthcare innovation, not every professional will be in a position to immediately do what is required. Healthcare professionals are, from time to time, asked to perform new tasks or activities and will need new skills and knowledge to do so. DeltaScan is a medical device that objectively measures brain signals of patients by EEG to help diagnose and monitor acute encephalopathy and delirium. Monitoring the brain helps in the following 4 ways: providing insight into the severity of illness, helping to identify complications earlier, measuring the effect of treatment, helping to prevent brain damage. DeltaScan is designed to be used in place of the current screening tools for delirium. It is a new method and therefore requires a new way of thinking and working. Every healthcare professional involved must be made aware of the harmful effects of delirium and the hospital protocol for prevention, detection, monitoring, and treatment of delirium. How does this work in practice? The ward manager should ensure that nurses are given 5 minutes per shift per delirium risk patient to perform a DeltaScan measurement. These nurses should be trained in the use of DeltaScan. All doctors, nursing specialists, and physician assistants involved should understand and emphasize the purpose of using DeltaScan. Each DeltaScan score should then be entered in the electronic patient record and included in any patient discussion, so that it becomes part of the medical policy. In addition, when recording a high DeltaScan score, physicians must then initiate the necessary interventions together with the nurse. To ensure the successful implementation of DeltaScan, there are 4 conditions that healthcare professionals should aim to achieve. These are: 1. Competence. Nursing staff should be trained in the use of DeltaScan. 2. Opportunity. Time should be made available for a measurement of each high-risk patient. 3. Motivation. Nursing staff should be aware of the added value of detection, monitoring, and treatment of delirium. And 4. Score follow-up. The DeltaScan score should always be followed up by the physician. The nurse is then able to recognize the value of taking measurements. For successful implementation, these 4 conditions should be adhered to, not only by the nursing staff, but also by all other healthcare professionals, such as the ward physician, the specialist, and the sister, nurse, ward manager. It is necessary, therefore, to identify for each person the skills and knowledge required and offer the motivation to learn. In addition, the individual that follows up the DeltaScan score and draws up the treatment plan should be identified. The project leader should make an inventory and direct this. In this way, healthcare professionals can support each other in the new way of working, therefore enabling each other to carry out the intervention successfully.